plan to mail those tests to Americans at home comes as the FDA warns against certain brands. The agency says some tests have not been authorized and have a high risk of false results. As CBS 8's Kirsten Holmes found out, people using certain tests are more likely to get a false negative.
Okay, so the at-home test could be sold under the names Lucent Diagnostics or Vivera Pharmaceuticals, but the FDA says if you have these at-home tests, just stop using them.
The FDA says also beware of tests with the trade name Eagle DX.
If you're negative on an antigen test, it doesn't mean you don't have COVID. So you got to confirm it with a PCR test.
Dr. Jotu Sandhu says the at-home tests are better at detecting higher levels of the COVID-19 virus.
PCR will pick it up at a very low level, which is it has high sensitivity and specificity.
President Biden announced he's ordering another 500 million free at-home COVID-19 tests in addition to the 500 million he announced last month, as well as free high-quality masks. A website will launch next week for Americans to order the tests. But for the growing list of COVID-19 patients like Chris Hooks, he hopes the at-home tests are accurate.
Had several symptoms: cough, sore throat, a little nausea, and tired.
But when he took an at-home test, it came back negative.
I was mostly at home, really wasn't going out. I think we went to the grocery store once, but even then we do pick up groceries. We don't go inside the store.
After a relative tested positive for COVID, Chris took a PCR test too. This time, it was positive. Chris says he and those around him are lucky that he didn't go anywhere to spread the virus unknowingly.
It's frustrating because, obviously the people who do that can obviously pass on COVID if they do have it, but it's also not their fault.
But he says he understands why at-home tests are still necessary.
If you don't have symptoms and you're fully vaccinated, you got your booster, all of those things, and you're like, hey, I need to go out to a friend's house. If you have symptoms, obviously PCR test is the way to go.
Kirsten Holmes, News 8.